Hello, my name is Mara Calderon, and today I'll be presenting Module 4 on the Chapter 7 case study on Mr. SD. So, Mr. SD is 63 years old. He was diagnosed with type 2 diabetes 5 years ago. He is on some medication, such as glucophage, which he takes twice a day. He's also taking captopril, which is for blood pressure control and the protection of his kidneys. Lastly, he is on Lipitor for control of hyperlipidemia. So Mr. SD complication history is that of acute periodic episodes of diabetes out of control, but has never experienced hyperosmolar non-ketotic syndrome or diabetic ketoacidosis. He had a 2-vessel bypass surgery 5 years ago, and he has moderate peripheral neuropathy, and he also has diabetic nephropathy. So now moving on to the assessment and the plan of diagnosis. Mr. SD has a few negative risk factors. Those are his age, his weight, and his blood pressure, being that of stage 1 hypertension. So the plan is to create a exercise program that will improve his blood glucose level, his lipid level, blood pressure, and also to lose body weight, all by establishing a routine to help the exercise be more habitual. So now to continue with the exercise prescription, it will be based on the information provided on Mr. SD. So it will consist of a moderate intensity of 40% through 59% based on the rate of perceived exertion. One more thing to consider in this case is that Mr. SD is a client with peripheral neuropathy, meaning that his feet will be typically affected, and he also may experience with sensory symptoms. So he'll be given instruction on how to examine his feet and practice good foot care. Now, the exercise prescription program will encourage non-weight-bearing exercises. So now for the formulation of the exercise will be based on the ACSM recommended guidelines of 150 minutes per week, as well as the FIT module. So starting off with the frequency will be 3 to 5 days per week. The intensity will be based on the rate of perceived exertion. So what we're looking for is a scale of 11 through 13. And the time will start with 15 minutes, gradually increasing to the 30-minute per session. Now, type of exercises, most of them will be non-weight-bearing exercises, such as stationary cycling, water exercises, moderate walking, chair exercises, or arm exercises. So that being said, this will conclude today's case study on Mr. SD. Thank you for watching.